When it comes to skincare, we are all affected by those pesky pores. Here to share tips on how to best manage them so you can put your best skin forward is founder of Renew MD Medical Spas and Skin by Dr. Sethi Skincare, Dr. Simran Sethi. Hi, Dr. Sethi.
Hi, Rachel. How are you?
I'm so good. Great to have you. You always
Thank you.
The best advice. What even are these pesky pores?
Yes, pores are very misunderstood. That's why I'm glad we're talking about it today.
Yes.
But pores are little microscopic holes in our skin that allow the skin to take in things we need and take out things we don't. So we all need them and they have a really important job, but they can go from being microscopic to be visible when they get bigger, and there are a few reasons why they will grow in size.
Yes, okay, so it seems like sometimes I'm having a great skin day and like my pores are invisible. Next day I'm having these big huge holes on my face. What is it that changes your pores so much?
Yes, good question. So first of all, some people do genetically have slightly bigger pores than others, so, but even then they can get larger and smaller. So pores get larger when they are clogged, and now they have to get larger so that they can allow that transport of things in and out. And then it's sort of a vicious cycle, because then they get bigger and they just actually attract more debris, and then they keep getting bigger. So you have to kind of break this cycle at some point, and there are ways to do that.
Okay, yes. So if I'm having a bad skin day, my pores look huge, what should I start doing to fix it?
Yeah, so likely if you're noticing your pores more on certain days and not others, it's because maybe you haven't exfoliated enough. So key is exfoliation. And even in my line, you know, we have exfoliants that are safe for all skin types, but they're still, because it's a medical grade line, they're stronger. So if you clean those pores out, they're not going to trap things, and they will start shrinking back because they have room to allow that transport of things in and out. But the second thing is hydration. You also have to hydrate the skin, lock in that hydration with a good hyaluronic acid, because if those pores are thirsty, again, they will start expanding. So exfoliation and hydration, which brings me to the most important point about pores. When you're addressing pores, it's a daily thing. It's it should be a part of your daily routine, and it's good for your skin regardless. But you can't, you can't sort of treat pores for a few weeks and then let it go, because they're just going to do what they're meant to do. They're going to get bigger, looking for more hydration and getting rid of stuff.
So is there anything, if someone is feeling like they have large pores regularly, is there anything that they could be maybe putting on their face that could be contributing to that, like something they're doing wrong? Right,
that's a great question. So likely if, if you have oilier skin, you might not be getting enough cleansing and exfoliation. So that's a very, very common one. That's why when people have acne, they also tend to have larger pores, or even if they're post-acne, they're not breaking out as much, they have oily skin, larger pores. It's also possible that you are perhaps not hydrating enough. So in the Bay Area, our weather is so dry. So sometimes you'll notice that in the winter, the pores are a little more visible. So if you're applying your moisturizer, top it off by sealing that moisture with a hyaluronic acid. And then if you have stubborn pores, there are treatments actually that can help, and they are very effective.
Yes.
One, which is easiest, is facial. So a microdermabrasion facial every month is going to give you a deep exfoliation. Now, if the pores are even more stubborn, there are laser treatments. I personally like the PicoSure laser because it's great for all skin tones. Very, very safe. It produces new collagen, so it has great benefits. But I find that amongst all the lasers, microneedling, this is the most effective treatment for pores. And then another fun one, which a lot of people don't know about, is Botox. You can use Botox to shrink pores.
I didn't know that. Okay, so how does that work? How does it
so when we normally inject Botox, we inject it in the muscles of the face so that you stop overexpressing, and that'll take away wrinkles. You can inject Botox just into the skin. So tiny dilute amounts of Botox, so little tiny injections. And what it does is it relaxes the muscles that open up the pores. So it takes away that opening ability of the pores, or the over ability of the pores to open. So they'll function normally. So that tightens pores and gives a glass skin appearance.
Very cool. I didn't know about that either. Thank you for the tips, Dr. Sethi. I do want to get to your products here on the table. You have a great skincare line, so tell tell us a little bit about what we've got here.
Yes, so the first group over there is our exfoliant. So a salicylic acid cleanser, which also has coconut oil. So it's going to really deeply exfoliate your pores, but it's not going to starve them of hydration. And great for anyone with oily, normal skin. And then the other one is actually our 10% glycolic acid, which is hydrating because it has marine peptides. So typically glycolic acids are great exfoliants, but they really burn the skin.
Yeah.
This will not do that, which is why it's so safe with all skin tones. And then those two are our top hydrators, our vitamin E and F serum. But remember, it's a great moisturizer, but it's not going to last as effectively unless you seal your moisture with our hyaluronic acid. And that's true for any moisturizer. Okay. So those two are sort of our hydration, our hydration duo.
Yes, it seems like the perfect skincare routine. Dr. Sethi, thank you so much.
You're
if people
welcome.
want to learn more or come visit you, where can they learn more information?
So they can always come to my office. RenewMDWellness.com is where you'll find us online, or my skincare line, skinbydrsethi.com.
Okay, thank you so much, Dr. Sethi. Thanks for coming in.
You're welcome.